Well, we now cross over to Stein Studios, Rock Milano, where Newsfirst Shami Russell is standing by. Shami, what do you have for us? Where Newsfirst Shami Russell is standing by. Shami, what do you have for us?
Thank you very much, Shaheen. Joining us tonight for a quick chat is Dr. Samantha Anand, the spokesperson of the Government Medical Officers Association, as well as Professor Indika Nathilaka, President of the Sri Lanka Medical Association. A very good evening to you both. Let's get into bolts and nuts quite fast, Dr. Samantha as well as Professor Indika. Dr. Samantha, the second death was reported today owing to COVID-19. Will this situation aggravate in the next few days?
No, that is what we don't want to happen actually, but if these preventive measures are not going to take seriously, like it is totally now on the hands of the general public, because the health sector and the armed forces and everybody has done their part to the level that we can't even expect, right? So therefore now the general public has to be vigilant. They have to adhere to the instructions that we have given, and if that is not going to happen, definitely this might go into a unpredictable situation and things might go wrong.
Professor Indika, flattening the curve is very important. However, when you look at the numbers in Sri Lanka, 11th of March we had one infected person, and then the number increased to 14 on the 17th of March, and then on the 27th of March there were no reported cases of COVID-19. However, now there seems to be an increase again. So 7 members were reported today being infected with COVID-19. What will happen in the next few days as far as this curve is concerned? Will it increase, decrease, or will we see a complete flattening of the curve in the next couple of days?
Okay, so thank you for that question. It's a very good question. And what do we mean by flattening of the curve is we bring down the number of patients that could be manageable within the resources of the health service. What you have explained, the situation that we have explained, the number of patients being detected per day slowly increasing, then coming down, and now we are seeing it picking up again. Probably we can explain this situation by considering the current group of patients as 2 categories. One category was the imported cases and the overseas returnees. So they came in an uncontrolled pattern. So the initial increase and the decrease that we see is actually the detection of those patients, the initial group. Then what happened was that there was local spread, within the country spread from this initial group. That actually happened within a very controlled environment, because most of those initial returnees or imported cases were either quarantined or isolated. Therefore, the second spread that happened within the country happened within a very controlled pattern. What we are seeing now are the patients that are being detected from those second wave of infection. So within this curve that you are telling, actually we can see 2 curves. The first curve is the imported cases and returnees slowly increasing and decreasing. Then those who have been infected from them slowly increasing. That's what we are seeing. So within next few weeks also, there may be a slow increase of those patients. Having said that, still the infection is happening within small clusters, and we sincerely hope that will remain within that as well.
Dr. Samantha, the WHO, the epidemiology unit says not to wear masks, but the Government Medical Officers Association has a difference of opinion on this. Why is that?
Yeah, actually now the WHO and the epidemiology unit, and as well as the health ministry, they don't advise not to wear the mask, but they are in the opinion that since the community spread of this disease has not yet happened, we should not wear, it is not advisable to wear the mask, since we need to protect the mask to use in the relevant time, and so on and so on. But if you really see how the crowd is behaving, when the curfew is lifted, people are moving for panic buying, and this so-called distancing is not being maintained.
Social distancing.
Social distancing, we say 1 meter, but you don't see even a 1 centimeter distance sometimes in the places where they gather. So there are so many issues, and people now wearing masks without our advices. So although the technical part says very correctly, we see the public is not really listening to the technical.
But do we have ample masks in Sri Lanka, Dr. Samantha?
Yeah, when it comes to that part, we had a problem initially that there were not enough masks even in the hospitals. But later on, the local productions, and there were some the imports are happening at the moment, and now we are producing here in Sri Lanka around 100 to 150,000 masks per day. I don't say that is adequate, but we are in a better wicket at the moment. So therefore, the wearing mask, again to the question, wearing mask, now we have requested from the ministry, now it's time to discuss this and give a clear idea to the public, clear advice to the public.
Whether they should wear the mask or whether they shouldn't wear the mask.
Yeah, and also we should educate the public how to wear the mask properly.
Right. Dr. Samantha, very quickly before I move to Professor Indika for my final question, very quickly to you, Japan has said that they have introduced and tested an antiviral oral medication called Avigan, and Sri Lanka is also now in the process of bringing down this medication. How successful is this medication? Does that mean that the world has struck gold in terms of fighting this COVID-19 virus?
Yeah, I need to highlight two things. The first is that they have not done any clinical trials as such to give scientific evidences to prove that this drug is effective. That is one thing to be, we should not use a drug without any scientific evidences. So the evidence-based medicine is the one that we practice at the moment. So there are no enough scientific clinical trials have been done. That is one thing. Secondly, and we heard that even Japan, when Sri Lanka requested whether they have approved this drug in Japan, as far as we know, the information that we got, even in Japan they have not approved it yet.
Right. Professor Indika, very quickly tell us, what is your message now to the public? Second death was reported. Now people are in a panic mode already, thinking that the curve is going to be worsened. What is your message to the public?
Yeah, again, we would like to say very clearly, this is not a time to panic. The patterns of infection and the deaths, basically, deaths have to be expected. If we follow the worldwide statistics, generally if there are 100 patients, there may be about 3 to 4 deaths. That is possible, and depending on the comorbidities that they are having. My main message to the public is there is no need to panic. It's a time to be vigilant, because the government and the Ministry of Health and the health authorities and the tribe forces and the citizens of Sri Lanka, we have been able to keep it under control. The most important thing is to follow the health messages and the advices of the government, and avoiding going into public places, crowd places, and following basic sanitation measures like hand hygiene. Those are the most important.
Thank you very much, Professor Indika Arunatilaka as well as Dr. Samantha Ananda. You can join Dr. Samantha as well as Professor Indika along with Dr. Sajeevan Amarasinghe as well as Dhananath Fernando, CEO of the Advocata Institute, with regard to the impact that COVID-19 has made on the country's economy. All this and more on Face the Nation tonight. Stay connected, stay with us for that. We're going for a short commercial break. Remember, face your fear, accept your war. It is what it is.